Dear students, welcome back. In the previous session, we have discussed about psoas minor muscle, which is one of the posterior abdominal wall muscles. So, psoas major and psoas minor we have discussed. Now, in this session, we are going to discuss about another posterior abdominal muscle, that is iliacus. Okay, this iliacus muscle is a triangular muscle. You can find here which appears in triangular in shape. This is a triangular muscle. So now we will see this muscle origin, insertion, nerve supply and its actions. So this iliacus is originating from upper 2/3 of the iliac fossa. So it is originating from upper 2/3 of the iliac fossa, and it is also originating from the inner lip of the iliac crest. So it is originating from the inner lip of the iliac crest and also ventral sacroiliac ligament. So here you can find ventral sacroiliac ligament. From there, some of the fibers of this iliacus is originating, and also from the iliolumbar ligaments. So this iliolumbar ligaments, which is connected the lumbar vertebrae to that of the iliacus. Okay. So these two ligaments we can study in detail when we are dealing with sacroiliac joint. Okay, so there you can find these ligaments. So this iliacus is originating from the 2/3 of the iliac fossa, that too upper 2/3 iliac fossa, and inner lip of the iliac crest. So this is the iliac crest. Okay. And also some of the fibers from ventral sacroiliac ligament as well as iliolumbar ligaments, and some of the fibers which are originating from the upper surface. So upper surface of the sacrum, that too lateral part of the sacrum. Upper surface of the lateral part of the sacrum gives some fibers. Okay, these are the origin of this iliacus. Okay, next, now we will see the insertion of this muscle. This muscle which is going to inserted into the lesser trochanter. So if you can find this muscle which is going to inserted into lesser trochanter. Normally during this course, the medial fibers of this iliacus is going to attach with the lateral part of the psoas major to form iliopsoas. So both these two tendons are getting inserted on the lesser trochanter. So if you see this iliacus muscle insertion, so as we know that this lesser trochanter is divided into medial part and lateral part. The anterior surface of the lesser trochanter is divided into medial and lateral part. So this iliacus is getting inserted into the lateral part of the anterior surface of the lesser trochanter. So this is very important and commonly asked in anatomy viva. So where this psoas major is inserted as well as the iliacus is getting inserted or iliopsoas is getting inserted. If they asked iliopsoas, then you can simply say that on the anterior surface of the lesser trochanter. If they ask specifically psoas major, where the psoas major is getting inserted, means you have to mention the medial part of the anterior surface of the lesser trochanter. If they ask iliacus, you have to say specifically it is getting inserted on the lateral part of the lesser trochanter, and this insertion is also extended up to 2.5 centimeters below this lesser trochanter, and this insertion is going to extend 2.5 centimeters below the lesser trochanter. So this is the insertion of this iliacus. If you see the nerve supply, so it is getting innervated by the nerves, the branches which are coming from the femoral nerve, that is from L2 and L3. So L2, L3, these are the branches of the femoral nerve which is supplying this iliacus. If you see the action, with the help of psoas muscle, it acts as an flexor of the hip joint. It acts as flexor of hip joint. So this is all about the iliacus muscle. Okay, in the next session we are going to discuss about another posterior abdominal wall muscle, that is quadratus lumborum. Thank you.